Hello, it's April 7th, 2020, and this is Holy Week. And this is the coronavirus update for today. And my name is Heerak Christian KIm. I'm an independent candidate for US Congress in Virginia's 8th District. That is Arlington, Alexandria, Falls Church, and Fairfax County in the state of Virginia. Today we have a lot of interesting things for you, including the question, is COVID-19 a Chinese biological weapon? So stay tuned for an answer to that. But we start by discussing what happened in the last 24 hours. And the Attorney General, or rather the Surgeon General, our Chief Medical Officer of the United States of America, was not kidding when we are going to have a Pearl Harbor moment. And as we all know, Pearl Harbor moment is a sneak attack by the Empire of Japan in Hawaii that initiated World War II. And the United States of America entered the Pacific War zone with the ending of dropping 2 atom bombs in Hiroshima and Nagasaki. As a Korean person, we celebrate on August 15th the independence of Korea, and that is independence of Korea from the Empire of Japan. So Japan occupied South Korea and North Korea because there was unified Korea at that time. There was no South Korea and North Korea. In 1910 to 1945, so 35 years, Japan occupied Korea. And so Japan colonized Korea. During the 35 years, the Korean language was forbidden in Korean schools by law. And so many elderly Koreans who came from that Japanese occupation era cannot read Korean. They can speak Korean because they spoke Korean secretly at home, but they could read Japanese, but they can't read Korean. And they could write Japanese, but they cannot write Korean because Korean was forbidden by the Empire of Japan. And also every Korean church was forced by federal law to have Shinto shrines and in the sanctuary room. And the Japanese Empire said, as long as you have the Shinto shrine in your church, you're welcome to worship your God. Because when you put a Shinto shrine in your sanctuary, you're recognizing that your God is under the authority of our empire. And they said, just think of it as a showing respect to a symbol of our country, the Japanese Empire. And many Korean churches said, we're actually worshiping God. God knows our heart. So why don't we just do that? So they tried to save their lives and compromise, but there were Korean Christians who did not want to do that, and they were executed by the Empire of Japan, which was an occupational power, because they were going against federal law. And so you can actually read about this in Reverend Bruce Hunt. So his last name is Hunt, first name is Bruce. In his book, For a Testimony. and it's published by Banner of Truth. And it's a publication company in the United Kingdom. And he gives a historical account of what happened at that time. I would highly recommend it. I actually went to a Christian high school in Philadelphia, Pennsylvania, where the grandchildren of Reverend Bruce Hunt attended. It was a Christian school founded by founders of Westminster Theological Seminary in Pennsylvania. Philadelphia Montgomery Christian Academy. Anyhow, that's just the background information. I guess a little bit sidetracked, but Pearl Harbor comment by America's Surgeon General kind of brought back memories. And for all the Korean people, the Japanese occupation is a very significant part of American or Korean history. It's decades long of oppression by the Japanese federal government. So anyhow, now back to our normal programming, and that is what happened in the last 24 hours. Confirmed cases stayed about the same as the day before and the day before that, at 30,000. So you see on April 6th, 2020, there were 367,507 cases. And today we have 398,785 cases. So about 30,000 cases that are confirmed. So that's the same yesterday, day before that. You can watch the previous episodes of COVID-19 update videos, and then you can trace it. But the disturbing situation comes in COVID-19 deaths. And this is where, when America's Surgeon General said it's going to be a Pearl Harbor week, this is what he means. And we're only on Tuesday. So we have Wednesday, Thursday, Friday, which is Good Friday, Saturday, Sunday, which is Easter Sunday to go. And now on Tuesday, we see that we have nearly 2,000 deaths in the 24-hour period. So that's a significant hike. In the last 2 days, death rate remained around 1,200. So that's an increase of about 800 deaths. And so in terms of percentage, that's about 66% increase in deaths. And so that's significant and it's disturbing that the day before the death rate was about 1,200. Day before that was 1,200 as well, but now it's almost 2,000. So it's a steep rise. So on April 6, 2020, you have 10,908 cases. But today you have 12,893 cases. So in terms of daily rise, the rise in percentage from yesterday to today, there's an 18% rise in the death rate, because if you divide 1,985 deaths by the total number of deaths as of yesterday, which is 10,908, you have 18%, which is an 18% rise from yesterday to today. So you're probably wondering, is it just us or is it everyone, right? I mean, it's a normal question to ask. Let's say it's raining outside, and it rained outside today in Arlington, Virginia. Wouldn't it be weird if you look out the window and your building is the only building where the rain is falling? There was a funny episode on Married with Children with the character Al Bundy. And he visited United Kingdom, and just one area was raining, and other area was like dry. And you may have seen other movies where the rain cloud just follows one person, and all around there's no rain. There's a sunshine. And this motif or theme can be found in a lot of different movies and TV shows. Now, after today, you're going to kind of feel like that because we have all these cases of COVID-19 and all these deaths, but none of our neighbors do. So it's kind of like rain and thunder and hail is falling on us, but not on our neighbors. And that is weird. Very, very weird. Look at our neighbors. Let's start with Canada. In Canada, the total number of COVID-19 cases are 17,897, and the total number of deaths is at 377. You kind of have to ask suspiciously because Canada wanted to close its borders early. Maybe they knew something that we didn't know. Maybe they anticipated us having all these cases, so they just wanted to close the border off so they could block the COVID-19 from getting up there. And so we see that they are not really, I mean, they are probably suffering, but not like us, right? And it's like just the next country over. Like from Virginia to Boston is probably closer than from like Albany, New York, or Michigan, Detroit, Michigan, to a city in Canada. And we know Detroit, Michigan is overrun with coronavirus cases, and a lot of people are dying. I read an article today, and that said just in two healthcare systems, two largest healthcare systems in Michigan, there were 2,200 healthcare workers who are sick with COVID-19. That's just the healthcare workers, like nurses and doctors. So can you imagine how many people have COVID-19 cases? Some of them have not been tested, so they're probably suffering at home. Some of them might not have signs showing too much. But this is America, right? In Canada, I mean, look at this. Only 377 deaths. There's something strange going on. There's rain, thunder, and hail in Michigan, but a short distance north in Canada, there's sunshine. Now, is our northern neighbor the only one experiencing sunshine? Is it possible that our southern neighbors are experiencing rain just like us? So let's go down to our southern neighbors, Mexico. They have 2,439 cases and only 125 deaths. 125 deaths. Now let's go to Texas, which is very close from Mexico. And in Texas, there is a crisis. I read in the news that Texas A&M University, which is one of the largest universities in Texas, with tens of thousands of students, which has a great nursing program, their nursing school has decided to move the graduation date up from mid-May to this week, Friday, April 10th, Good Friday. Do you know why? Because Texas is so desperate for nurses. There are so many Texans dying from COVID-19 and nurses getting sick. They are desperate for nurses. So the Board of Nursing in Texas has made a decision to give every nursing student graduate, as soon as they graduate, a nursing license without taking the NCLEX RN, which is a board exam for nursing. because they need to get nurses onto the COVID-19 battlefront to help nurse the patients. So this nursing school is graduating their students like over a month early, cutting the program, all the courses short, all the clinicals short. And when the dean of nursing school was asked, "You sure your students are ready for this?" She said, "I have confidence in my nursing students and our program, that it's an excellent nursing program, in our clinical experiences, that we train them well. Because I have confidence in them, I'm happy to send them out to COVID-19. It must be a good nursing program, because I don't see other nursing school deans talking like that. So maybe those who are interested in going to nursing school should apply to Texas A&M. With a nursing dean with that kind of confidence, they're probably cranking out great nurses. But anyway, Mexico, which is just short distance south of Texas, they only have 125 deaths. So it's raining and thundering and hailing in Texas, but sun is brightly shining in Mexico. Now, doesn't that sound a little bit strange to you? It's kind of like rain and thunder and hail is falling on your house, but every other house in your neighborhood has sunshine. Is that normal? What do you think? We are rational human beings, so we can think rationally. Now, next, neighbor. Our co-adversary for decades, Russia, which used to be USSR, with whom we engaged in Cold War. They have a lot of people in Russia. You could Google Russia and see how many people they have. And look at the number of cases in Russia. It's even less than Canada, 7,497. Look at the number of deaths, 58. Does that sound normal to you? What are they drinking? Maybe there's something in the water in Russia that is different from what we're drinking. Or maybe there's something a little bit more, shall I say, sinister? But it's strange. You have to agree with me, it's a little bit strange. Now, to add salt to our cut injury that is stinging, let's look at Cuba, which is close to Florida. And we all know about the Cuban Missile Crisis. We almost had nuclear war, or rather, we almost got bombed by nuclear bombs. Nuclear bombs from Cuba would have traveled in 5 minutes and destroyed half the country or more. That's the Cuba Missile Crisis during President John F. Kennedy. This Cuba, where Russia or USSR placed those nuclear missiles to attack USA preemptively, Cuba only has 396 cases and only 11 deaths. Compared to Brazil, which is our closest ally and friend in South America. Why don't you Google how many people have COVID in Brazil? Brazil is our ally, kind of like Russia and Cuba are buddies. And Cuba only have 11 deaths. Now, tell me, do you think that is normal? Now let's look at Greenland. It's one of our neighbors, all the way up like to the north, near North Pole. They have 11 cases and 0 deaths. But that may be expected because they're like way far away. But the point is this: every single one of our neighbors are receiving sunshine when we are receiving rain, thunder, lightning, and hail. So that begs the question, don't you think? What's going on? Something is a little bit not right, shall we say? So the logical and rational question that we may have to ask, are compelled to ask, or even forced to ask, is the question, is COVID-19 a biological weapon made in China? Let's go through the literature. Let's have a review of literature here to see what kind of research is out there. Let's approach this scientifically in a scholarly manner. An article published yesterday has a title, Boris Johnson's government has considered the possibility that the coronavirus may have accidentally leaked from a Chinese lab. Accidentally leaked from Chinese lab. This article is by Adam Payne. Now, the question is this. The British government has not denied this article or the claim. So the question is, do you know James Bond? James Bond, shaken not stirred. MI6, the British intelligence, James Bond, what have they discovered? And we know MI6 is a superior intelligence service, the service of the Queen, going all the way back. They may have discovered intelligence that they may not be willing to openly share. But obviously, if the British government is speculating that it is something that leaked, in quotation marks, from a Chinese lab, what kind of Chinese lab would create a virus? It's not your run-of-the-mill high school Chinese lab. So what kind of lab creates a virus that can kill thousands of people? War biological weapon comes to mind, biochemical weapon. How about you? What do you think? So it must be some kind of lab that is military grade or next generation biological weapon research center. We probably have that too in America. A bio weapons lab somewhere, maybe in New Mexico. Now, the question is, was it accidentally released? I mean, would you create a biological weapons lab without safeguards so that the weapon would accidentally leak? What do you think? Now, if you ever have known Chinese PhD students in any subject, chemistry, physics, engineering, history, even in German philology, or medicine, one thing you know is that they are not sloppy. I've been in a PhD program in UCLA. I've done research at Harvard. I've done research at Brown University. I've done research at Cambridge. I have done research at Heidelberg. I've done research at Hebrew University of Jerusalem for over 3 years. And every Chinese student I've met around the world, I have not met a single sloppy Chinese student ever in any of the PhD programs in any subject. So you're telling me a country that has no sloppy PhD students in any subject anywhere accidentally spilled a biological virus that can kill people? I don't know. Can those accidents happen? Maybe, yes. I mean, people make mistakes. So there are two questions here. Was COVID-19 created in a lab? Lab with quotation marks. The second question is, was it released accidentally in quotation marks? Now, the British government seems to think that it was created in a lab and it was released accidentally. Now, is Britain the only government that thinks that way? Is British intelligence the only secret agency, covert operation that has discovered information that leads to that conclusion? Apparently not. Because you see the article below, it says China outraged that the Brazil minister suggests COVID-19 is a part of plan for world domination. So here we see that Britain removed the quotation marks. It wasn't an accident, but rather it was a plan. Plan to dominate the world. Well, as you know, Marxist ideology is about global domination, right? That is built into the communist system, is global domination. For anyone who's studied Marxism, Marxist-Leninism, as the Bible says, can a leopard shed his spots? Next article. The trail leading back to the Wuhan labs, and it's a national review. There are Americans, politicians, scientists, historians, policy researchers, international relations researchers, some in the military establishment, and even Secret Service who believe that this is a biological weapon and intentional. Bioengineering has been around for a long time, as you can see. We have bioengineered fruits that become bigger, become resistant to pests. We have manipulated DNA, and there's CRISPR that can cut and paste DNA molecules to alter the fundamental core of a virus or a bacteria. Now, in the United States, many scientists are saying we don't have the technology to engineer a virus that can cause harm in humans. When these scientists in the United States say this, they're referring to us, United States of America. Now, obviously, these scientists are not working in secret bioengineering weapons labs in New Mexico or wherever they are, because it's secret. We don't really know where they are. So maybe USA does have the technology to create a bioweapon that is a virus weapon like COVID-19. Uh, Maybe it's called Ameri 20. Who knows? You know, we may have a bioweapon that is similar in nature, or we may not. At least the scientists who have been asked seem to say we don't have that technology yet in the USA, and that may be true. We may not have the technology. A lot of Chinese nationals have been getting PhDs in bioengineering, chemical engineering, chemistry, biology from Harvard, MIT, Caltech, Stanford for decades now. And some of them go back to China and they conduct their research. They're brilliant wherever they are. It's not unlikely that some of them have been co-opted into bioweapons program in China. I mean, that shouldn't surprise you because in America, the United States government, Department of Defense, often co-ops experts in bioengineering or chemical engineering, chemistry, biology into their weapons program, paying them much higher than what they would get paid as a university professor. And so it's not unlikely that this is happening in China. And maybe there had been a biological war weapons kind of a competition between China and America that's been going on for decades. We don't know, right? Because people are not talking about it the way nuclear arms race was talked about. But probably in the beginning stages, they probably didn't talk about it too much either, right? With passage of time, people talked about it more, and there was concrete proof that there were nuclear atom bombs, so it was easier to talk about because we dropped atom bombs in Hiroshima and Nagasaki. Now, in terms of biological weapons, we don't know. We don't know any actual cases of anybody using viral weapons yet. But it does make us think because Russia and Cuba are such low numbers, and China's numbers are really low. It's like in the 3,000s, right? The death from COVID-19. So some senators in America are saying, oh, they're lying, which is possible. Maybe they're lying and there were tens of thousands of cases. But it's a little bit hard to lie, about those things because we have reporters on the ground in Beijing and also in Wuhan as well. And you have like reporters reporting from Wuhan. So that's a little bit harder to prove. I mean, I'm not saying it's not possible. Maybe they have 3,000 more, but not like us. I mean, we have 2,000 people dying every day. I mean, total in China is like, for the whole period, is like 3,000 something. So why the difference? Why the difference indeed? Obviously, if it was a controlled release with a purpose, I mean, obviously, if they're going to use a biological weapon, they have to have some of their people dying to make it look like it's not a biological weapon, right? They wouldn't want us to retaliate with our nuclear bombs. So, I mean, I'm not saying it is a biological weapon. I mean, it's too soon to make a definitive statement because we need evidence. But it seems like there's intelligence in that direction. It's possible it was accidentally released. It wasn't intentional, and maybe China has an antidote, and that's why they were able to contain it within a short period of time. It's possible there was accidentally dropped and released, but obviously it seems like it was well controlled because there were only like 3,000 some cases. So maybe they have the antidote. Who knows? We don't know. I mean, if we create a biological weapon in America, wouldn't they also create an antidote? I mean, would you release a biological weapon into the world without an antidote? So I don't know. I mean, it's a question that I think is rational to ask and logical to ask. and more importantly, fair to ask. And we live in a free country. We are protected by the First Amendment. We have freedom of speech, freedom of ideas, and we should have the freedom to raise these kind of questions without being thrown into jail, like it would happen in a communist country like China. So that's why I'm raising this question. I'm not saying this is definitely the case, but it's a question that I think we should ask, and we should do our review of literature. We should do our research question. We can engage in qualitative research, interviewing different people in different communities, intelligence community, scientific community, political science community, academic community, and theoretical thinkers, people who just think on a theoretical level, or strategists. And we could do quantitative research. And in a sense, I've kind of done a quantitative study here on a rudimentary level, right? I'm comparing our numbers of COVID cases and our death rate from COVID cases. Those are numbers, or that's a quantitative data. And I'm comparing that with our neighbors, right? Canada, Mexico, Cuba, Russia, Greenland, their numbers. So it's a kind of a quantitative research. And I've kind of produced a body of literature, a literature review of sorts. So it's a form of rudimentary study that I am introducing here, that hopefully somebody will pick up and take it further with other qualitative research and quantitative research, asking research questions, employing SPSS programs and other data analysis programs, using different kinds of ethnography and different kind of narrative analysis and different kind of research methodologies, using quantitative and qualitative research techniques to answer this question. And let's see where that research question takes us. Because as a civilized nation like United States of America and Britain and Brazil, Germany, France, the rational and scientific way to go about this in order to find a solution is to do research into the question. And the question I'm throwing out is COVID-19 a biological weapon made in China? If the answer is yes to the qualitative research and quantitative research, and we can prove this beyond the body of doubt, we can solve this problem overnight, because if China has the antidote, if the answer to the research question is yes, then we just need that antidote. And we could use diplomacy or any other strategies, soft diplomacy, hard diplomacy, whatever, to get the antidote we need. And it will be solved overnight. Obviously, the answer to the research question can be no. And as researchers, we gotta approach this research question with an open mind. And more people conducting this research, using qualitative and quantitative and even mixed methods research, may be a wise way to approach this question. Because right now, I think the problem is people are approaching this from a singular approach. They're assuming that this is like a natural virus that developed in a natural environment through a natural process. And